Hi, I'm Dr. Mila Brujic, and today we're going to be talking about are soft contact lenses dead in clinical practice on the OI show with Dr. Jackie Garlich. We thank Bausch& Lomb for the support of this episode of the OI show, where we're going to be talking about soft contact lenses and in particular daily disposable lenses and whether or not that opportunity still exists for patients and practitioners alike to really enhance that patient's wearing experience. Dr. Jackie Garlick, welcome to the show. Probably one of the most popular and well-read emails every Monday morning in my inbox. But Jackie, if you could share with everybody in the audience a little bit about yourself, your clinical practice, and the stuff that you do outside of the office as well, too.
Sure. Hi, Mile. It's so nice to be on the video call with you. And we were just talking before, and we're going to see each other next week. It's great. I'm getting a lot
Yeah.
of Mile time right now. It's wonderful. Yeah, so I have a private practice in downtown Boston that is both a primary care practice and an ocular surface disease practice as well. And I'm the president of Glance by Eyes on Eye Care, which is an email publication that I started writing many years ago, 2016, I think I started writing it, but it's a once a week email that gives a clinically relevant rundown on what practicing clinicians need to know in their exam room. So new FDA approvals, promising research coming out, something in the news that your patient might ask you about. It's just a very quick curated email to try to help the busy practicing clinician.
Yeah,
Happy.
Jackie, it's absolutely fantastic that email blast that you guys do because it's almost like you wrote it with the clinician in mind. So when I read it, I realize that okay, this is like exactly what I wanted to know about the topic that's listed here. So I've always appreciated that, and it's actually one of those emails that I never skip over. I always open it up to see
Oh,
what you've actually talked about. So you did a great job with it.
thank you.
But Jackie, I want to pull back the curtain a little bit on clinical practice a little bit because there are a lot of forces in the industry right now, especially when it comes to patient care, that are trying to disrupt the way we care for our patients. And one of those disruptors is in the realm of contact lenses. And a lot of clinicians have said, well, why am I fitting soft contact lenses? Is this something that you see as a viable part to your practice? Is this something that you're now saying, yeah, I don't really do this anymore and I don't really find value in this? What's your perspective on soft contact lenses within that clinical space for optometry?
I mean, I certainly fit a ton of soft contact lenses. And I have a primary care side to my practice and then the dry eye side to my practice. Every day, clinicians, particularly ones in a primary care setting, are going to run into one of three patients, or maybe all three. One, the patient who desires contacts. This person who's never worn contacts, they want to wear them. Two, the person who's in them and is enjoying them, is having a great time. Three, the person who dropped out. And these are three opportunities for your practice, particularly that last patient. Why did that patient drop out of contact lenses? If this patient desires to get back into contact lenses, there is a huge opportunity for, of course, to refit them into a contact lens, but really address the underlying reason why they weren't able to get into contacts in the first place. And you can literally build a dry eye practice off of those patients. There's so many of them. And I think a lot of these patients that have dropped out, the number one reason patients drop out of contact lenses is discomfort. So there's an
Mhm.
unmet treating the ocular surface issue that I think, are seeing in the industry that we need to address. And all of this will just kind of build and build and build and grow your contact lens practice. So I certainly see a lot of these patients,
Yeah.
and it's an important part of my practice.
So you brought up so many good points and so many clinically valid points. Jackie, I want to kind of bring up another thing that I'd like your opinion on because it's pretty interesting when you ask patients, and the Contact Lens Institute actually did a large survey where they asked patients, hey, what's the most valued source of information on contact lenses from your perspective? And every single time their eye doctor was the number one most important factor in contact lens and new contact lens information. But then when you peel the layers back a little bit and you ask patients that have just been in for an eye exam in the last 3 years, were contact lenses introduced at the time of the visit? And there's this small percentage of patients that have actually been introduced contact lenses as an option. And when you look at presbyopes, where the need for refractive error is the highest, it seems like we're offering them these options at the lowest levels. So I guess the first question is why do you think that is? And do you think there is opportunities to help patients in these categories? And is it good for the patient and the practice?
I think the more education that you can provide your patient and differentiate yourself from an online eye exam, which are now popping up all over the place, what value can you bring to the exam that a patient cannot get online? And the value is education and properly evaluating ocular surface disease, obviously good retinal exams, but knowledge is what the patient is wanting, and other what is new in the industry. This goes for all things. So there's certainly an opportunity to answer your question on why practitioners are not might not bringing them up. I think there's a few reasons. One, you can get into your own routine of what you do exam after exam. Two, if you're really hustling, you have an overbooked schedule, there have been add-ons, you're really going to hit your top things first, and maybe contact lenses is not up on that list for some practitioners. I think those are, and maybe also if a patient doesn't say anything, why should I open this can of worms with a patient if they're not interested in it? Is my guess what these hurdles are. But there's so much opportunity. I always want to be the person who tells my patient the new thing before my patient knows the new thing. So even if I am not going to fit them in something, I say, just so you know, down the road, this does exist. So if you need, reading glasses with your contacts, I have another solution for you down the road, just so it like puts that in their mind and that they're not thinking, oh, I'm just dropping out of contacts as I can't read with these contact lenses.
Jackie, such clinically valid points. One of the things that I personally found is I actually had to retrain myself a little bit several years ago, where really when we got heavy into electronic health records in the 2010, 2011 era, where we started kind of really heavily incorporating all this, I realized like EHR forced us to put labels on patients when we put them in our schedule. So patient X was here for an exam, patient Y is here for glasses, patient Z is here for contact lenses. And I found myself actually being a prisoner to my schedule. I was walking into an exam room, and if somebody's wearing glasses, not even thinking about asking about contact lenses or having our technicians ask about contact lenses. And then talking about busy schedules, the worst thing is, kind of as we're putting a bow on everything, do you have any other questions? Yeah. Am I a LASIK candidate or am I a candidate for contact lenses? Okay, well, let's sit down and let's re-engage this conversation. What is your approach, I guess, so that you're not caught off guard like that at the end of the exam? How do you approach contact lenses? How do you approach patients with refractive error? And how do you just approach the discussion of contact lenses? Is it you? Is it your technician? Is it a combination of the two?
It's usually a combination. So obviously, if someone's an existing contact lens wearer, that person is easy. But you're not wrong. They are on the schedule for like comp exam versus comp plus CLs is how I'll write it on my exam note.
Hmm.
So it can also be like an internal bias that you already have going into the exam, and the patient hasn't even
Yeah,
said anything yet, and you're already like, they're not a contact lens wearer. It's not marked on my schedule that way.
yeah.
My technician will ask and say, any interest in contact lenses, or are you a contact lens wearer? And sort of just ask that quick question. I think that's more efficient because they can kind of get that out of the way so that you already know before you're asking the last question, any other questions for me in the exam room. But so I kind of have that done on the front end so that I know that kind of going into my exam.
Jackie, there's so many advances in contact lenses right now, and it's amazing that. So I've been in clinical practice. I know you're going to find this hard to believe, but a little bit longer than you. I've been in clinical practice for 22 years. So with that said, you always think you're all right, you're maxed out at technologies, and then something new comes out and new modalities come out. Daily disposable lenses have revolutionized the way we're fitting patients. It's absolutely unbelievable. Do you still feel there's opportunities for clinicians in the realm of soft contact lenses with respect to presbyopes, astigmatic, and even those patients who are spherical lens wearers who are just saying, I want a better wearing experience.
Yeah, absolutely. I mean, I have a almost 90% daily contact lens wearing practice. So I'm a firm believer in daily contact lenses, fresh lens, reduce the risk of infection. I explain that to patients also. So they are often interested in switching out of a 2 week or a monthly lens to try to really, improve their comfort if comfort is an issue. But anytime a patient comes in, I'm asking all the questions. And like you said, I've retrained myself and just made it a habit what I'm asking them. How are your contacts? Can you wear them all day without any issue? Are you noticing any dryness? Just ask sort of these probing questions. And if a patient is not like in love with their contact lenses, I say, you know what? We've got lots of new lenses coming out. There are so many lenses for a reason. Not everybody likes the same lens based on all kinds of reasons. And if you're open to trying something else, I have something for you. So I like doing that. And my patients really like saying, like, what's new? What's the newest thing? Can I be more comfortable? I don't know. I'm used to what I'm used to. This is the same when we're talking about, even just, I'll talk a lot about dry eye, but even a dry eye patient, if you just come into the exam and say, how are your eyes doing? Same as last year, no change. Well, what does that mean? Were they dry last year and it's the same as what it was last year? So that is not a question I'm generally asking. I'm asking more pointed questions to sort of find out, what the pain point is for the patient. And this can be said for your multifocal lens, for your spherical patient who has a low amount of sill that is not in a toric lens and is, feeling I'm getting more glare at night and I'm uncomfortable with that. Huge opportunity to move that person into something where they can actually see better, and you will be a hero to that patient for just correcting that little bit of uncorrected astigmatism.
I
Lots
couldn't
of
agree with you more. I couldn't agree with you more. I actually think too, daily disposables have really opened up an ease of wear schedule for those individuals who may want the option of contact lenses, but don't necessarily want to wear them all the time. It's just such a logical fit for that lifestyle choice because, again, they want them for certain things, but they don't necessarily want to wear them all the time. It just makes it a great opportunity for those patients.
Yeah.
Jackie, any final comments on soft contact lenses and their level of importance within clinical practice?
I mean, soft contact lenses is something that I think is a bread and butter of so many practices, or if not, is not currently, really can be. This is a billion-dollar market. So many patients are interested in contact lenses. I think in the world of these online eye exams and patients not feeling the value from an eye exam, you're there. That's your job. You can provide the value, the education on what's new. Contact lenses are a great addition to any practice. And this is just a regular soft contact lens. There's certain levels beyond that, specialty contact lenses that are an important part of practice as well. So a huge opportunity for practitioners to bring that in or to do more of them. And I always say this to my office manager, we can't improve upon anything we don't track, right? So it's once you
Mhm.
start tracking the metric, which and you can encourage, practitioners to do this. How many contact lens opportunities do you think that you saw today? You can track that, and then that might put a little more real number on, oh, there is a lot more demand than what I'm realizing, and you'll see growth there.
Yeah, Jackie, I could not agree with you more. I think one of the biggest and most important things with this is we're hitting a patient unmet need. It's still remarkable to me how willing certain individuals are to wear contact lenses and how much they want what's best and most appropriate for their eyes. And we're fortunate that we have a vast array of lens technologies. And fortunately, the companies have now actually put together what they refer to as families of lenses where you have the multifocal option, you have the toric option, you have the spherical option, so that if you have one eye that needs spherical and one eye that needs toric correction, they have that available, which actually makes it a beautiful adjunct. One of the things that I always share is, this cost of lost opportunity that happens with patients. And it is so critically important for us to understand that patients are coming to us because they want to see we're caring for their most valued sense, and placing the highest level of technologies in their eyes, I think, is critically important. Jackie, this was awesome getting a chance to pick your brain clinically. It was great. And The more I talk to you, the more I realize our passions are very, very similar when it comes to clinical care for patients. Thank you, Jackie, for being a guest on our show.
You're welcome. Thanks for asking me.
And thank you all for joining us for this episode where Dr. Jackie Gerlach, I think she truly proved that contact lenses, soft contact lenses, certainly are not dead in clinical practice. Thank you all for joining us on this episode of the OI Show. We thank Bausch & Lomb for the generous support of this episode of the OI Show. Bausch & Lomb really is in the toolbox of contact lenses. They really have every one of those options available for us, and really the highest level technologies when it comes to daily disposables with the Infuse family of contact lenses, and really the newest kid on the block, the Infuse for Astigmatism. So Bausch & Lomb, again, thank you for the generous support of this episode and really the enriching and the intriguing discussion around soft contact lenses, and it's important in our practices, in particular for our patients.